Welcome to the Professional Patient Perspective 2-minute drill, where the play for today is how to be a sane and healthy hospital patient. First, some general points. Notify your health insurance carrier before you go to the hospital. What to bring to the hospital. You're going to need a picture ID like a driver's license, your health insurance card, a couple of bucks, and one credit card. Also, I think it's important to bring an iPod or a Kindle or a book to a hospital because I can tell you from personal experience, when I was at the Mayo Clinic in Rochester, Minnesota for almost 2 months, I was there by myself. The familiar voice of a podcast or a movie or of music I was familiar with, that's what kept me from being afraid, feeling alone, and being homesick. Bring a watch to the hospital. Not an expensive watch, like one of these rubber Iron Man watches is good, because if you could keep time and try to keep in your normal routine, I think it helps you from getting depressed. Bring a different attitude regarding privacy and dignity. What you're used to at home and the personal space that you're used to, you're not going to have in a hospital. Don't blame the medical professionals. They need to stay objective. So they do whatever they must to do the job while respecting your privacy and dignity. But that means oftentimes that your privacy and dignity are different. IVs. IVs are when they stick the needle into your vein to give you medication. They are a necessary evil in a hospital. But here's a few tips. When you have to get an IV, and almost everyone admitted to a hospital will get one, because God forbid there's an emergency, it's the most efficient way to deliver medication. When the medical personnel comes in to give you the IV, be careful. Make sure they pick a spot that works for you, not for them. So make sure when they stick you, just be nice and respectful and say, please try to stick me somewhere that's going to stay there for 3 days. I'm right-handed or I'm left-handed. I may have to use the phone. I may be writing. Tell them that. Nurses. Please remember that doctors give orders, but nurses execute them. Please also remember, nurses are always short-staffed. They sometimes have anywhere between 3 and 8, even 12 patients. Be polite. Always say please. Always say thank you. Visits from friends and family. Now, when you're in the hospital, it's the biggest thing to you, but it may not be the biggest thing to your friends and family. Focus on who calls you and who comes to visit you. Do not focus on who doesn't call and who doesn't come to visit you. Bring your sense of humor. Let's talk about the daily schedule in the hospital. You can't control it, but here's what you need to do. The night before, write down questions that you want to ask your doctor. Be as thorough and succinct as possible, because at 7 a.m., you're going to be awoken by a bunch of doctors who are doing what's called rounds. During rounds, it's very important that you converse with the doctors and then confirm everything they're going to do, whether that's diagnostic tests or medications. Write it down. If they're going to change anything, write it down. Because what you don't want to have happen is the doctor do something by themselves like, oh, he doesn't need sleep medication, I'm going to take that off the chart. Or, oh, it looks like he's doing well, we're going to take the pain meds away, let me do that. Communicating with the outside world. Talking about making phone calls, emails, going on Facebook. Be careful. You could be on a lot of medication and you don't want to communicate with business associates because you may let your guard down, you may not be at your sharpest, and you also don't want to oversaddle your friends with your worries because they're all going to disappear when you leave the hospital. So be careful who you call and what you do and what you say. What you can do is let family and friends know what's going on via email. Give them updates of the daily events. You could even include your thoughts, whether you're afraid, you're scared, it hurt, you don't know what's going on, you don't like this doctor or that doctor, because this way they can read it at their convenience. So try to use your friends and your loved ones as efficiently as possible so that it's you going through the experience and not them, okay? Discharge. It's time to leave the hospital. Make sure you get clear instructions from the discharge nurse as to what you can and cannot do and when you can and cannot do them. It's important to also get copies of the reports from all your diagnostic tests because you're going to want to scan them into your computer when you get home. It's also important to get a list of the doctors who saw you in the hospital and what they saw you for. And with that, we have concluded the Professional Patient Perspective 2-minute drill, where the play for today was how to be a sane and healthy hospital patient.